Hello and welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. Today, let's learn about colon cancer. Colon cancer or rectal cancer or colorectal cancer is a cancer which starts in the large intestine. It is the fifth most common cause of cancer in India. 90% of the colon cancer patients are more than 50 years old. What are the risk factors for colon cancer? Older age, obesity, low physical activity, smoking, alcohol, low fiber diet, red meat, and people who have diseases like ulcerative colitis or Crohn's disease are some of the risk factors for developing colon cancer in the future. Is there a screening method to detect colon cancer? Screening is a test which is used in the general population to identify a disease early. For colon cancer, screening is recommended after the age of 50 years. There are three types of screening tests which are usually recommended. One is a fecal occult blood test, which is giving a fecal sample to test for the presence of minute amounts of blood. This is recommended once a year. The second is a flexible sigmoidoscopy, which is recommended once every 5 years. And the third is a colonoscopy, which is recommended once every 10 years. The advantage of a colonoscopy is if there are small polyps which are mushroom-like growths in your intestine, they can be removed and sent to the lab to see if there is cancer in it or a pre-invasive form or precancerous form. Colonoscopy reduces the risk of cancer by 50 to 70%. What are the symptoms of colon cancer? Blood in stool, mucus in the stool, constipation, alternating constipation and diarrhea are some of the common symptoms of colon cancer. Weight loss or unintended weight loss is also an important symptom. Also, elderly patients who have anemia should be suspected of having colon cancer and should be investigated. In advanced cases, when the cancer spreads to the peritoneum, the patients present with abdominal distension or pain in the abdomen. There may be fluid in the abdomen called ascites, or if the disease spreads to the lung, they could present with breathlessness or fluid around the lung, which is called pleural effusion. If the disease rarely spreads to the brain, they can present with headache, seizures or fits, or weakness of the limbs, etc. How do we diagnose colon cancer? Tests to diagnose cancer can be divided into three types. Tests which are essential to give a diagnosis of cancer. This is a biopsy. Biopsy is a needle test which is done from the tumor. In colon cancer, we do a colonoscopy and do a biopsy from the lesion in the colon. If the disease has spread to other organs, we biopsy from that particular organ to prove that the patient has cancer. The second test which is done is test to stage the disease. We have to find out where all the disease has spread, whether it has spread outside the colon, to the lung, to the liver, the omentum. So we do a CT scan of the abdomen or an MRI of the abdomen or a PET CT scan. The third are tests which help in aiding in the diagnosis. There is a blood test called CEA or carcinoembryonic antigen, which if elevated may help us in making a diagnosis of colon cancer. CEA is not elevated in all cases of colon cancer. CEA is also elevated in non-cancers like ulcerative colitis or Crohn's disease. So what we must understand is a raised CEA doesn't mean colon cancer and a normal CEA doesn't mean one does not have colon cancer. It is just a supportive test. How do we treat colon cancer? The treatment for colon cancer depends on the age of the patient, fitness of the patient, stage of the disease. If the disease has not spread to distant organs in colon, then the patient undergoes a surgery. So in colon cancer patients where the disease is limited to the colon or the nearby lymph nodes, the surgeon would first do a surgery and remove the cancerous part. This sample is sent to the lab for testing, and 10-15 days later, once the histopathology report comes, the final stage of the patient will be known. Based on that, the patient will be prescribed chemotherapy if required. In stage 1 colon cancers, chemotherapy is not required after surgery. In stage 3 colon cancer, or disease which has spread to lymph nodes, chemotherapy is recommended after surgery. In stage 2 patients, there are multiple factors to decide whether a patient needs chemotherapy. One of those factors is MSI status. The other factors are a few risk factors which are seen on your histopathology report. So to summarize, if the disease is limited to the colon or the surrounding lymph nodes and has not spread to other areas, operation is the first treatment. For stage 1 tumors, no chemotherapy is required after surgery. For stage 3, chemotherapy is required after surgery. For stage 2 patients, chemotherapy may be decided on a case-to-case basis. This stage post-surgery is called a pathological stage after the surgical specimen is submitted to the lab. In stage 4 colon cancer, the disease has already spread to distant organs, so it is not possible to cure advanced colon cancer patients. Here, the main treatment would be chemotherapy and targeted therapy, and the aim is to reduce the symptoms of the patient, to improve the quality of life, to reduce the burden of disease, and prolong life. In stage 4 colon cancer, surgery may be required sometimes if the patient is constipated or in obstruction. That time, a bypass will be done to let the intestine out so that the patient is able to pass motion. But this surgery is not a curative surgery. It is not done with the intention to cure the patient. It is only done to relieve the symptoms of constipation. The side effects of chemotherapy which is given for colon or colorectal cancer include hair loss, nausea, vomiting, weakness, loss of taste, blackening of the palms and soles, diarrhea, discoloration over the nails, tingling and numbness over the feet and over the hands, and fall in hemoglobin, WBC, and platelet counts. Most of these side effects are reversible. Patients can easily manage these. These side effects disappear once the chemotherapy is stopped. Targeted therapy does not have chemotherapy kind of side effects, but patients who are put on targeted therapy may have hypertension, loss of protein in the urine, poor wound healing, rashes over the scalp or over the face, and sometimes reactions during infusion of the medicine. To summarize, colon cancer is the 5th most common cause of cancer in India. Colon cancer can be detected early. Screening is available in the form of colonoscopy. If detected early, surgery is the treatment of choice. Chemotherapy is given in stage 3 and stage 4 colon cancers, and in some stage 2. In early stages, chemotherapy is given to reduce the recurrence of colon cancer, and in advanced stages, chemotherapy along with targeted therapy aims to improve the quality of life and prolong the life of a patient.